Hello, I'm David Patterson. I'm a professor of cardiovascular medicine at UCL and with a clinical base at the Whittington Hospital in North London. I've been particularly interested in the prevention of disease, particularly cardiovascular disease, but also other long-term conditions for many years. We have a novel approach to long-term conditions, which I would like to describe to you. It is an approach to support clinicians in the delivery of high-quality care to patients wherever they or the healthcare professional are sited. There are four components to this approach to long-term conditions. The first relates to a birth-to-grave electronic health record, which is standards-based, and one of the main standards is that it is web-based. It means the patient has one clinical record, and the clinician, wherever they are sited, contributes to that record. It is a very powerful database with built-in advisory system, built-in analytics. We've developed an education platform which hitherto was delivered on a face-to-face basis and is now web-based. There are two components of this. One is directly and relevant to the patient and developed with the patients. And this sits next to the healthcare professionals syllabus. One of the aspects of the healthcare professional is that they will look at and be examined on the content in the patient's record. And this is an attempt to try to get a better understanding between healthcare professionals and the patients as to each other's needs. The other components, one is clinical governance, and because we're delivering a distributed service, at the moment on 35 sites, but as we roll out across the country, we hope many more sites, is how do you ensure high quality delivery of a service as close to the patient as is possible, but of a very high standard. And we have an innovative approach to how this can be delivered and how one can get CCGs, GP sites, community pharmacists, all working together with outcome measures and working in a synergistic, collaborative manner. The final aspect of the quartet, if you like, is the data analytics, because the electronic health record is a very powerful record, and every episode with the patient, whether it's face-to-face, whether it's remote, whether it's related to the app that the patient is using, is recorded, which gives us a fantastic repository of data and outcome measures. We're now linking in terms of the perfect outcome measure of a stroke, and using the really impressive database about the number of strokes that occur in a particular time, which is updated every 3 months. It gives the number of strokes per CCG in that time frame. And moreover, it can give us the number of people who've sustained strokes, who had atrial fibrillation, for instance, beforehand, or who were on anticoagulants. So we've got a perfect model for those who are trying to prevent the disease and how they're doing against the outcome measure of the actual strokes that occurred in that given time frame. Now, one of the things we're trying to address, of course, is the comorbidity, because stroke prevention involves several different long-term conditions, including diabetes, including lack of exercise, sedentary behavior, including hypertension, perhaps the most important, and smoking. So we have an approach which is increasingly being delivered to the patient and engaging them in self-testing, self-managing. And we are developing then the means of overseeing without being too involved from the patient's perspective in their care. This is an opportunity to really move long-term conditions, because we can expand the number of long-term conditions because our database is a database for all conditions from birth to grave. We think there are cost savings. We think that there are improvement in quality of care and outcome measures. Thank you for your attention.